But wait, OB nurses don't sit around rocking babies all day? No way, you work hard and the work is challenging. That's why we love it. But it can and does cause burnout. There's a way to prevent it and you'll seriously begin to love your job again, more than ever. Let's go. How to prevent burnout. OB nurses, I'm talking to you. You give and you give and you give and you work in hella stressful work conditions. I know, everyone thinks we rock babies all day. We don't. Long hours on your feet, go, 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 or sit, 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 and boom, drive-by baby happens. Dang, that's adrenaline. Hey, I'm Mandy. I'm the birth nurse. I'm an OB nurse on a mission to change birth culture to be more parent-centered, trauma-sensitive, and I do that by proving to parents that their bodies are powerful and they're unstoppable. And I support nurses supporting their patients in voice, choice, and understanding. Don't forget to hit that subscribe button so you don't miss anything. Hit the bell so you can get the new stuff first. Like if you like it and share with the OB nurses in your life. We can't do this alone, people. Who feels a bit burned out? Who feels overwhelmed at work? Overwhelmed thinking about your next shift? Let me know. Is that you? You don't get a lunch break, you feel like you can't take one. You love the team you're on maybe, but you still feel like you're swimming upstream sometimes. I see you. You're amazing, by the way. But it's hard to keep up day after day. I want to help you not get burned out. Stay in your career. You're passionate about it. We need you and your skills and gifts. OB nurses are the most important people in the world. But how? How do I keep going? How do I combat all of the contradictions and handle all of the challenges? You know what I mean? The tug and pull between what the provider wants and what the patient wants, that never-ending Pitocin discussion. And then those really, really hard days, the ones when nothing is going to right, nothing's happy, everything's going to shit. The answer is trauma-informed care. Huh? What even is that? What is trauma-informed care for labor and delivery nurses? It's like going into a room with a blank slate. You don't know the person's story, experiences, perspective, perception, fears, strengths, nothing. You don't know anything about the person, even though you've read their whole chart, you've seen thousands of births. You don't know what this one's going to be like because of this unique individual. It is understanding labor and delivery, but also understanding that it has a physiologic aspect to it, a psychological aspect to it, and that can be stored in the body and affect the body. It is an understanding that a human comes to you with their own unique individual experiences, and they can be affected by external factors, which is us. Trauma-informed nursing care is care for the individual person because it has nothing to do with us. We are there to give them an amazing experience. We are there to help them through their unique birth experience. Not ours, not the hospital's, not the provider's experience. We are there to be part of their experience. That's what trauma-informed nursing care is for a labor nurse. That was on IGTV the other day. That's the secret to how you're going to prevent burnout, how you're going to stay in the job you love, using the passion that you have for birthing people. Knowing what to do is the first step. The next step, let's work on figuring out your unique superpower. Yeah, I know, all OB nurses have unique superpowers. I go in more in detail about that in the 3 Stories Effect. But you have a special one, a unique one, that's just yours, that we need to tap into for your sake and your patient's sake. That's the next video. It's either right next to my head or right below me in the comments. See you there. And if you haven't had enough, which I know you haven't because you're just a little sponge of learning, then head on down to the description and download my 31 fascinating books that every labor nurse must read in 2020. You don't have to read all 31, just get started with one. It will change your life.